Good afternoon, everyone. My name is Lisa Nagel. I'm from the CAP Center here at NDSU School of Pharmacy. We are pleased to welcome you to our series on chronic disease with today's focus on social determinants of health. I'd like to share a few housekeeping items. We'd like you to use the Q&A function for questions, which we will answer at the end of the webinar. During the webinar, there may be assessment questions. Please utilize the chat function to answer these questions. This webinar will be recorded and available for viewing and continuing education. The recording will be placed on our website and YouTube page. After it is ready, I will send out all the information to participants, and please feel free to share this with your colleagues and your students as they might not been able to attend today. We also have a few upcoming webinars that I will be sharing information and registration via email, so please watch for those as well. With that, I'd like to introduce our expert speaker for today. Dr. Rebecca Leon is an ambulatory care clinical pharmacist in the Office of Population Health Clinical Programs and adjunct assistant clinical professor in the Department of Clinical Pharmacy at the University of California, San Francisco. She provides direct patient care, comprehensive medication management, and consult services for 4 distinct programs at UCSF: asthma, complex care, transitions of care, and hypertension and diabetes. She graduated from the University of Pacific's Thomas J. Long School of Pharmacy and completed an ASHP accredited PGY1 pharmacy practice residency with an emphasis in ambulatory care at Kaiser Permanente San Francisco Medical Center. Her primary areas of interest include social justice, developing innovative pharmacy services to achieve health equity, expanding ambulatory pharmacy services, interprofessional collaborations, developing comprehensive opioid overdose prevention programs to mitigate the opioid epidemic, and geriatric deprescribing. When I first contacted and met Dr. Leon online, I was very impressed by her enthusiasm and passion for our patients. I hope you are all as excited as I am to hear her speak today. With that, I will turn it over to Dr. Leon for her presentation.
Thank you, Dr. Nagel. I'm really excited to be here. Social determinants of health and just advocating for patients is really one of my passions. And so let's see here. I do not have any conflicts to disclose. And here are the learning objectives for today's session. So let's begin. So social determinants of health, they make up about 80% of what drives health outcomes, okay? So these include the circumstances in which people are born, grow up, live, work, age, and the systems that are put into place that deal with illness. And really only 20% of a person's health and well-being is related to the access of healthcare and quality of services. Again, the rest of it is driven by all these other things that we call social determinants of health here. And so what is the impact on health and well-being? Well, it's divided into 6, social determinants of health are divided into 6 domains, and they are economic stability, neighborhood and physical environment, education, food, community, safety and social context, and then lastly, access to the healthcare system. In addition to what is listed on the table, there are other examples of social determinants of health as well. And these include systemic racism and discrimination, LGBTQ justice, reproductive justice, immigration reform, climate change, physical activity opportunities, and polluted air and water. And so these social determinants of health, they contribute to wide disparities and inequities in health outcomes. And so let's see here. I have some, in the next couple of slides, I have some specific examples of how social determinants of health affect your communities here in North Dakota, as well as your patient populations. So more than 1 in 10 people in North Dakota still live in below the poverty line and do not have enough income to cover basic living costs and needs. And while there's been slight improvement since 2010, there's still a lot of disparities, as you can see from the slide, that exist across age, race, geography within the state. Next, for neighborhood and physical environment, more than 1 in 4 North Dakota homeowners over age 65, as you can see from the right-hand side here, are burdened by housing costs. And then monthly housing costs are exceeding faster than the rise in income, so greater than inflation. And so in 5 North Dakota counties, at least 30% of seniors are burdened by housing costs, and that's not even counting those who are non-seniors. In terms of education, 74% of 74% of youngsters have parents who are all working. And this is actually the 6th largest percent among the United States. And unfortunately, though, in North Dakota, many of these children do not have access to childcare. So there's a lot of childcare deserts, as you can see here, mentioned in that second panel. And in terms of preschool or early education enrollment, which is key to success in later life, it's one of the lowest percentages here in the United States. And 62% of third graders are not reading standards. In terms of hunger, 1 in 18 people in North Dakota are facing hunger. And in terms of children, that's 1 in 13. And so while most North Dakotans have enough to eat, there are still many who don't. And then these challenges compound their health outcomes and well-being. In terms of social and community context, studies have found that this connections, relationships with people, networking, volunteerism, all these affect also the health of the community and also the well-being, like mental health of a person. And unfortunately, 30% of seniors living in North Dakota, the largest percentage in the United States, are living alone. And 19% of reported people surveyed reported adverse child experiences. Healthcare access in North Dakota is actually also kind of limited. So as you can see here, the children with no health insurance is 6%. That's higher than a national average of 5%. And then in terms of primary care, access to primary care, that is, there's still a huge shortage, as well as shortage to dental access and shortage to mental health access. And as you can see here, this is the last slide in terms of statistics for social determinants of health. Adult obesity is up, suicide deaths are up, and drug overdose deaths are up. And unfortunately, in terms of health behaviors, people being physically active is low. There's still quite a few people who are smoking and using alcohol and tobacco. And in terms of alcohol consumption, North Dakota has the 2nd highest binge drinking rate among the United States after Wisconsin. So all of these compound how social determinants of health, impact overall health and well-being. And I know that your focus here in North Dakota for this series is also about chronic conditions. So I just wanted to bring that into how that plays into it. And one of the chronic conditions is diabetes. And so as you can see here, there's an inverse relationship between social determinants of health and diabetes. Many of these here, the social determinants of health, they are indirect impacts that lead to direct outcomes of reduced health access. So because of the reduced economic stability, social environment, physical environment, access to healthcare, these then leads to, like I said, these direct impacts of processes of care like foot screening because people don't know about it, so they're not going to get it, access to patient care, and then also these self-care behaviors, then they're not adhering to it because they may not understand the burden of diabetes, the outcome of diabetes, or how to access care and so forth. And then that leads to worsened health outcomes, in this case, worsened glycemic control. And then it increases then the diabetes complications, which DPN stands for diabetic peripheral neuropathy here. I'm sorry, I did say it was the last statistic page, but this is actually the last one. And this one's showing here how the diabetes rates in North Dakota are inversely impacted by income and education level. And also there's a huge disparity in terms of race as well as to who's impacted by diabetes. And the one other thing I wanted to point out is that in North Dakota, it's only one of 4 states that does not have mandated insurance requirements specific to diabetes coverage. So this means that people with diabetes don't have guaranteed minimum coverage for their medical expenses. And you can see here, this leads to a lot of dollars in medical claims and in terms of claims related to diabetes care. So what can we do as pharmacists now that I've talked about all the things, all the ways that social determinants of health affects our communities, our patients here in North Dakota? Well, as one of the most accessible healthcare providers, really, we have a huge role and responsibility that we can play in social determinants of health. We are usually the first point of care for many patients. We're familiar with the lives of our patients because we see them regularly, in the pharmacies, in the ambulatory care setting, in the community setting, even in the hospital setting. And this awareness of our patients' non-related medical concerns, such as their transportation, housing, food security, and also just how their neighborhoods are, it can help us to create greater understanding, awareness, and also can help us to develop practical patient-centered solutions to help them with their health outcomes and access to the medical system. So we need to do our part to screen for their social needs so that we can connect patients to these services that are available. So here are some more specific ways of how we can address each of those domains in social determinants of health. And I'll give you a moment just to take a look at this. Again, this session will be recorded, so you have access to these slides afterwards. But for the sake of time, I'm not going to read out everything here on the slide. So I'll give you a moment to just read that. And so I wanted to give an example for one of the ways here at UCSF that we've been helping our patients who are low income, also limited in English speaking. And so what we do actually every year during Medicare's open enrollment period in October and November and December, we host these Medicare Part D outreaches where we help our pharmacy students actually in our School of Pharmacy. It's built into our curriculum where we do these outreach events and we help our patients look at their medications and then compare the Medicare Part D plans that would be most cost effective for them based on their healthcare needs. And likewise, we also enroll patients who qualify then for the Social Security's extra help, as well as any help them complete any enrollment papers in patient assistance programs, patient foundation programs, and so forth. And so when I mentioned this idea to Dr. Daigle, I think this might be something that you guys will pursue here as well. But we've had a lot of success with this program in helping our patients. So I just want to give this as one example of what we pharmacists can do to address social determinants of health. Another way that we can help our patients is something you do almost every day in the pharmacy already, is utilizing drug formularies to help them overcome medication access issues. So anytime a patient's drug isn't covered, we can offer providers the alternative, like the covered alternative, or assist with prior authorizations. So just for your for your help, I've put in the most common formularies here in North Dakota. Next, I just wanted to point out the other ways that we can help our patients with prescription drug cost. So I do want you to refer to the session handout that will be provided for you at the end of this presentation for a specific list of charitable drug distribution programs, drug coupons that they can utilize, as well as drug discount programs at retail and online pharmacies. Okay, and this handout you can print out and put into your community pharmacies, retail pharmacies, and workplaces for your reference. I also want to point out that there are government programs that can help with lowering prescription drug costs, and I will be actually going through some of these in the next couple of slides, as well as resources that our patients can access if they're not sure how to enroll into these different government programs or access these different government programs. And then I'll also talk about patient assistance programs and patient foundation programs. Okay, so for our patients who qualify for Medicare, a lot of times it's really confusing, figuring out which plan to choose. And if you don't have something set up like we do here at UCSF to help our patients figure out which Medicare plan is best for them and which saves them the most money, there are actually some resources here in North Dakota that you can refer your patients to. So there is the Senior Health Insurance Counseling. These are qualified health counselors that can help patients figure out which plan is best for them, as well as the National Council on Aging Center for Benefit Access. These will help patients who are low income enroll into those additional benefits, like I mentioned, extra help if they qualify. And then there are also 340B based discount programs. This is a federal program that was created that requires pharmaceutical companies to sell outpatient drugs at a discounted price to healthcare organizations that care for our uninsured and low-income patients. And so eligible patients can get these prescribed medications at discounted prices. And so make sure that when you have patients who have a prescription medication that has a high copay from their current insurance plan, or it is not covered by the insurance plan, one of the things you can ask that hospital or provider is if they offer a 340B based discount program. Next, they can all, in addition, you can also look into patient assistance programs. So these are drug, medication, or prescription assistance programs that are run by pharmaceutical companies that can provide low or free medications to patients who are low income who do not qualify for any other government program. Okay, and so one of the ways you can find out what patients assistance programs are available is to use the North Dakota Prescription Connection, as well as these other search tools. And then there are also patient foundation programs, and these are established by nonprofit organizations to provide financial assistance, support services, as well as access to those high-cost drugs. And so there are a few notable patient foundation programs that I wanted to point out to you. The first one is Health Well Foundation, and they not only provide financial assistance, but they'll have counselors to help with patients figuring out, again, like which medical plan would best help them, how to navigate their disease state, and then connect them to the specific programs where they can get their drugs at affordable prices. For patients specifically with diabetes, there's also insulinhelp.org, and this will help them with getting insulin and other diabetes medications. And then for patients with HIV or AIDS, they can turn to the North Dakota AIDS Drug Assistance Program. In addition, there are some other search tools here that I've listed that you can use to find other patient foundation programs. And so another way that we can address social determinants of health is to help patients who have low health literacy. And 1 in 5 Americans is functionally illiterate. This then leads to them not even, this low health literacy leads to higher likelihood of hospitalization, higher medical costs, because they don't understand what the information that's provided to them at their appointments, at discharge, or what they're reading on the internet. And so sometimes patients with low health literacy will go to great lengths to hide it from providers because of shame, because of fear of judgment. And so it's important for us as pharmacists, if we're seeing our patients struggle, or even if we're seeing them not understanding the information that we're providing for them, that we take the time to create a shame-free environment where we can talk to patients and we can provide them information that's easy to understand. So sometimes, to help our patients, we can take a moment to observe, to see how they are, filling out the forms. If they're having trouble, maybe we offer to help them filling out the forms. Maybe we use visual aids instead of just signs that are purely in words. And then we can also ask them if they actually understand, like verify their understanding using the teach back method. We can also see if they are, if English is not their first language, and then therefore use translated health information. So here are some resources for you to provide a lot of material in printed language, in multiple languages. And then there are also videos in case patients would like to use that instead, because if they can't read well, or maybe their reading level is low, or again, English is not their first language, or even if the translated information is in a higher reading level than they are comfortable with, then perhaps videos would be useful for them. So the other one here, the Health Science Information Consortium of Toronto, they have so many really wonderful videos that you can use for your patients. And there's even information in American Sign Language on there. And so let's jump into then of how can we start that process of asking patients about their social determinants of health? I mean, it seems kind of awkward to just randomly ask our patients about their social needs, but it's actually not random. There is an algorithm here, and that's what I'm going to present now. So first, of course, as clinicians, we want to treat the condition that they have, right? And that means either providing them the medications that they need, or in terms of my case, as an ambulatory care pharmacist, I'm engaging with them about their asthma, diabetes, hypertension management, and doing the screening and adjusting their medications and so forth. So again, treating them for what they're here for. Then after that, because we've developed rapport with them now, develop a relationship where we can kind of talk about things in their lives, we ask them about their social needs. Now, this can be really sensitive. So in the next couple slides, I'll also address how we can use empathic inquiry to ask them about these sensitive topics. Once we identify their social needs, we can then refer patients to the appropriate social services or other organizations that can help them with their social needs. And then lastly, we advocate for them. And that means just really just coming back around and asking, hey, do you still need help? What else can I do to help you to live better, to access, to get to your appointments, to make sure that you're eating well, to make sure that you're feeling safe, to make sure that you understand what's going on, and how can I help you with accessing the healthcare system? Now, I do want you to be aware that a lot of times patients may be reluctant to disclose. And this could be that they're scared about not being able to provide for their family. They're feeling shame about it. They're fearful about what we would do with information if they disclose why they're having social needs. Maybe they're worried that their children would get taken away. They might not be able to stay in their homes. They might be treated differently. There's also the fear of stigma. Trauma might also make it difficult for them to talk about the challenging situations that they've had in their lives. There also could be power dynamics that we're not aware of, of how they view their healthcare providers, power dynamics also within their families. And then there's social and cultural norms that shape how different cultures view about sharing struggles and getting support for social needs. So just keep these in mind. If a patient may not seem responsive the first time you ask about their social needs, that's not because they don't have it. It's just that they might be unwilling to disclose it the first time. So be patient and then continue trying. And also there are other ways too to ask about social needs, and I'll address that in the next couple of slides. So I mentioned this earlier, that there's an approach that we can take to asking patients about these sensitive topics, and that's empathic inquiry. And this is really just a conversational approach to screening for social needs that promotes partnership, affirmation, patient engagement. And it means that we just relate to patients from a place of non-judgment, curiosity, understanding. That we're saying to patients, hey, I'm here for you. It's okay. I'm not here to judge. I'm just here to help, and to meet them where they are, and to let them share what they're comfortable with, and then to affirm that it's okay, and then to help them with their needs after that. Okay, and so this technique or this approach was developed by the Oregon Primary Care Association. So you can check out their website for more information about this empathic inquiry approach. But it has been studied and shown to be feasible for implementation in community pharmacy settings, in community clinics, just anywhere, honestly. So how can we ask patients about social needs? And so I wanted to provide you some actual questions that you can use in case you don't know where to start. So sometimes you can ask leading questions like, what happened next? Could you tell me more about this? Or open-ended questions like, how long have you been without food? Or what's the reason for your call? Or where are you located? Or who would you like us to call? Or what services would you prefer? If you're short on time, or if patients are reluctant, maybe closed-ended questions might be better. So is this what you requested? Or are you able to find transportation to your appointment? Do you have an interpreter? Can anyone help you make this appointment? How can I be of assistance, you know? Or sometimes you can ask reflective statements in this, or say it in a reflective way. So it sounds like, how that could be like, it sounds like you could use some help figuring this out, or I'm hearing you say that you're unsure how to proceed. And so sometimes when we rephrase what the patient's trying to get out or hint or to us, that opens the dialogue for them to share about their social needs. Really, though, the primary questions that we just need to ask is like, what is your housing situation? Are you worried about it? Are you running out of food? Are you having trouble getting transportation to your appointments? Are you feeling lonely or isolated? Do you want help finding work? And so, you know, this slide and the previous slide, these are just all ideas. You can come up with your own ways too of how to ask patients. There's no wrong way, really, because it's just about you caring, coming from a place of caring and advocating for your patients. So however you do it, okay, just don't worry that it all has to be done in one sitting either. This can be through a long period of time because these patients are going to continually come to you, you know, in the pharmacy, in the ambulatory care setting, in the community setting. And so usually you'll get a chance to ask them over multiple times, you know, how they're doing and follow up on it too. So don't feel that you need to have this perfect in one sitting or one time, or that you have missed opportunities if you don't get it right. Just the important thing to have and to ask is, again, coming from a place of caring and that your patients know that you care for them and that you're just asking these questions, not because you're trying to be nosy, but because you want to help them, okay? And if in your workplace, that time to ask questions is really limited, this is actually a really great handout that you could then provide patients. It's really simple. It's also translated in English and into Spanish. And this is where they can just check off if they have any needs and they can hand it back to you in the pharmacy. And then after that, you can follow up with them about how, what services that you can connect them to. So again, if you don't have time, this is a really great questionnaire to use. So after you identify those needs, what can you do? Right? So in the next couple of slides, I'm going to just show you what are some of the programs here in North Dakota that you can refer your patients to based on what social needs they identify with. So if they're saying they're having trouble getting food or if they're worried about food, here are some hunger relief programs here, and I'll give you a moment just to take a look at that. These organizations, this information is also in the session handout. If your patients are talking about transportation issues, these are some programs that they could use. There's the North Dakota Statewide Transit Program. There's also VA vans for our veterans that they can use. And then connecting patients to case management. This is huge. You know, for us as pharmacists, we really might not know what else is out there, right? But a nurse, a social worker, a community health worker, they might know. And they also might be having more time and bandwidth to connect our patients to these community resources and to close the loop. So in the next couple of slides, I'll talk about ways that we can refer our patients to case management. So for patients who are living in the Grand Forks area, All True Clinics has case managers that can help them with accessing the appropriate referrals and resources. For patients who have the Sanford health plan, they also have multiple case management programs, some for specialty needs, some for transitions of care, some specifically for elderly. And so you can just give a call to that number or email them, or check out that website to see what are all the different case management programs. And these are available to patients at no additional charge. In addition, the North Dakota Department of Health and Human Services, they also have case managers or resources to connect patients to case managers. And then for our elderly patients or patients who are disabled, there is the North Dakota Aging and Disability Resource Link. And this is a really useful webpage too that connects our patients to resources for home services, community services, and these will support our older patients and adults with physical disabilities. If you're not sure where to start, Like say your patients don't have these specific health plans or live in that area that I mentioned at first in Grand Forks. Sometimes you can just go straight to First Link 211, because this will help you identify just based on your zip code or the area that you're calling from, like what's available in your area. And they can help you then figure out like who to connect patients to or what to connect patients to afterwards. So I usually find 211 to actually be a really helpful starting point if I don't know where to start. And then for a broader sense, if your patients are just kind of temporarily in North Dakota, but they're going back somewhere else, or they may not be living in North Dakota full time. The USA.gov website's a really great one. They have a telephone line as well, and then that will also help connect with people with government benefits and services. So let's jump into our patient case then. And this is actually based on one of the patients that I have seen in clinic and I'm still following with. So I've adjusted some of the facts here, but it's a pretty real case. So CL is a 68-year-old Latino male. He's at your pharmacy to pick up his new prescription for dapagliflozin, and he appears fatigued, hungry, irritated. And, based on his medication list, his past medical history includes type 2 diabetes, hypertension, benign prostate hyperplasia, hypothyroidism, and glaucoma. And he just happens to carry his lab results with him. So you can see that his estimated GFR is 87. His A1C was elevated recently at 9.6. And his blood pressure actually was not too bad. It was 128/56. And since he's there at the pharmacy, he's your Medicaid patient. So, his new prescription, the dapagliflozin, is not covered by insurance. So what would you do next? So feel free to use the chat function right now and put in which option you would choose. A, advise patient to use a discount coupon to help pay for a dapagliflozin. B, review the drug formulary and contact the provider to recommend empagliflozin as a covered alternative. Or C, use empathic inquiry and ask the patient about his social needs. Or D, give patient the social screening form. I'll give you a few more seconds there to respond. Okay. So let me just take a look at the chat really quick here. All right. So what I want to say is that all these options, none of them are wrong. And they could all be right. But what I would do first is to do B, review the drug formulary and contact the provider to recommend a covered alternative. And then even after that, to make sure that the patient can afford, since it's Medicaid, it should be zero copay. But if the patient did not have Medicaid, say the patient had Medicare, then to make sure the patient can afford that copay, right? And then if they couldn't, then you could try to apply the discount for that I mentioned in option A. And then after that, if you have time, go through the social needs screening. And again, you could use either the empathic inquiry or the form. And it just really depends on the time and bandwidth that you have in your workplace setting, but also your patient's reading level, reluctance to disclose, their comfort level, whether you have a long line of patients waiting, for your services. So again, none of these are really wrong. It's just really, I just wanted to give you ideas for where you can start to help our patients. Okay. So, now going to almost go into the Q&A time, but just wanted to wrap up our discussion here. Oh, let me pull that in. That really, as pharmacists, we have so many ways that we can interact with patients. So as I mentioned earlier, economic and social disparities in North Dakota, they persist across age, education, income, racial background, and they raise the risk for health conditions like heart disease, diabetes, obesity, and so forth, right? And that we as pharmacists, we have so many interactions with our patients, and we can be quite influential in the way that we can address patients' needs by identifying their social risk factors and referring them to the appropriate services. And that using empathic inquiry or even using that social screening form, we can better understand our patients' needs and connect them to those services. So before we go into the Q&A time, let's go through the self-assessment questions. And so you can use the chat also then to choose your options here. And so social determinants of health refer to A, the reasons some groups of people get a disease while others do not. B, random differences in the spread or prevalence of a disease in the community. C, non-biological factors such as economics, education, health access, environment, and community that impact health outcomes. Or D, social media, television, and the internet. So which one would you choose? Okay, and if you chose C, that's correct. All right, for our second self-assessment question, how can pharmacists address social determinants of health? A, through medication reconciliation. B, counseling about smoking cessation. C, asking about social needs using empathic inquiry. Or D, all of the above. And if you chose D, that's correct. And for our last self-assessment question, what are strategic approaches to ask patients about their social needs? A, using open-ended questions. B, using closed-ended questions. C, using leading or reflective questions. Or D, all of the above. And if you chose D, that's correct. These are my references. And let's now open the time for questions. So I'm going to stop the screen share here. And Dr. Nagel, I'll let you lead.
Sure, thank you. Wow, Dr. Leon, that was really good. I really appreciate how you focused on North Dakota and gave so many examples of what we can do in our state. And even examples of how it's so important for pharmacists to be aware of this information and know like what to do when a patient may screen. I do have a couple questions here. So I'll go ahead and ask those. And if anybody also can ask any in the Q&A, that would be great as well. So besides the example of Medicare matching, do you have other examples how you've used technicians and or students to help with social determinants of health?
Sure. I precept students and residents in my clinics. And so I'm also training them, to use the empathic inquiry to ask patients about their social needs when we're doing our interviews with patients, when we're talking to them, even during med rec, even actually, as they're doing the medication review, like asking them, so are you having trouble getting this medication? How are you taking this medication? What are these side effects are you feeling? And then like if they have diabetes, oh, so you're timing your glipizide with your meals, and well, are you having trouble eating your meals on time? Like, what are the meals that you're eating? Like, what are these foods? Where are you getting these foods from? And then, so I like to teach my students, instead of jumping directly to providing health advice, like we tend to do, like we've been taught in school, to, okay, tell our patients to eat more vegetables, to exercise, to do this and this and this. But instead of doing that, I tell my students, take a step back and actually spend some time asking patients these questions. Meet them where they're at. Because if you don't meet them where they're at, you're not providing useful information for their lives. We cannot give health information that is not useful to patients, that's just going to go past their heads or, out through in one ear and out the other. And that's not going to help them. That doesn't impact their lives. That doesn't improve their health outcomes. But if we take the time to meet them where they're at and to ask these additional questions, or to be sensitive to how their answers are and what's going on in their lives, we can then be more helpful by, realizing that they have these specific needs, and then connecting them with a social worker, with a nurse case manager, or with a community health worker. Or, since I provided some of these resources in the session handout, you can provide these to your patients directly too. Like, hey, here's where you can get transportation help. Here's where you can get some food, so you can eat healthy, and so forth. For my patients, even if they tell me like, I don't feel safe in the neighborhood, I recognize that. And so when I talk with them about something even like as simple as exercise, I'm not telling them to go outside and take a walk because they've already told me I don't feel safe in my neighborhood. Instead, then I will look for ways they can exercise at home. So I'll say like, hey, here are some sit and be fit videos, or here are some videos that you can do while you're having your Zoom calls, if you have your camera turned off, because many of our patients now, maybe they're working from home, or I don't know if you're aware, like there have been a lot of attacks on Asian Americans in the United States, and we have a huge population of Asian Americans, and I myself am Chinese here in the Bay Area. So many of my Asian patients, particularly the elderly ones, they don't feel safe going out. So I've even connected them to, sometimes there was this organization that created a walking program, okay, like a walking buddy program. And so for some of my patients who are non-Asian Americans, they've said to me, I don't really have anyone to walk with, and I would like to start walking. I'm like, hey, I have another patient who actually is scared to go out because they're worried about getting attacked. Do you mind? Do you want to like be a buddy to someone else to help them so that they can go out while you get your exercise? And my patients are like, sure, let's do that. So those are just some creative ways, to help patients like, get exercise in a safe way. Or like I said, if they don't feel safe going outside the home, I'll recommend the things for home. Likewise, like even for wellness or mental health, I'm looking at creative different ways. Like, does your employer have a wellness program? Sometimes those are untapped resources that we can help bring to our patients' attention just by asking that question, like, have you ever checked that out? And they're like, no, I didn't think about that. So just like I said, meeting patients where they're at, taking that time to just take that extra minute or so, like, hey, have you thought of this? Or how are you doing? And then really finding out the details in their lives so that you can help them and you can connect them.
Oh, great information. And I know we have several preceptors on this call and that will watch this on demand that weren't able to attend today. So I think that's really good information. And I really like the idea about a walking buddy because that will also help combat loneliness. And so some population that, that would help with that. I do have one more question here. Do you have some examples of how smaller rural communities can connect people to services? Some of our rural areas don't have food banks, transportation, and things like that.
Yeah. Before I moved back to San Francisco during the pandemic, I was living actually in Fresno, and that's actually one of the poorest zip codes in the United States. So Fresno is in Central California. It's actually one of the agricultural capitals in the United States, but it's one of the poorest zip codes in California and the United States. And there were also a lot of rural areas where people could not access food banks or public transportation, and people didn't even have telephones or the internet. I think really the key thing here is utilizing what the community identifying who the community workers are. And then seeing what resources are available there. Sometimes if you can't identify anything, this is where I would say, like, how about you do something then? Like, how about you champion something for your community? If there's a need there and there's no available resources, when I was in Fresno, I partnered with universities then to create collaboratives and resources. And a lot of times universities have more connections or reach than just a small clinic or just a small organization, because they are bringing in students and professors and preceptors like yourselves and alumni, and they have those networks, right? They have all these things that are just not explored. So that's what I did. I actually partnered with Fresno State, and we were trying to address the opioid epidemic in the Central Valley. And so we created a collaborative to educate our communities about the opioid epidemic and to provide opioid overdose prevention training. And that's just one of the ways, specifically for food and for transportation and such. I think here it's just about being creative, identifying what those needs are in your community, being creative, and like I said, looking to see what's out there. And me throwing out the idea of partnering with a university or a college or a school is just one idea. I don't have the answers for your specific question because it's hard, right? So I'm just going to encourage you to be creative and to see what there is, and then to really get yourself out there. You see the need, get yourself out there, start talking to people, see who you can partner with, see who you can connect with. This is why I like to tell my students and my patients, we as pharmacists, we're patient advocates. We're here to help serve you. We're here to help you. And a lot of times I go outside of just my everyday pharmacist role, to help my community. So I encourage you to do the same.
Okay. I feel like she gave everybody on this call a little bit of a call to action. One last question, Dr. Leon, and then I will put up the information about the CE. So the last question, do you have examples if these services and screenings in the pharmacy can be reimbursed?
I don't have a sense that they can be reimbursed right now. And I mean, even just getting pharmacy services, like for my AmCare services to get reimbursed right now is so difficult. So I don't think social needs screening will get reimbursed. However, I think you'll just see I hope that by being healthcare providers and by being the ones to interact directly with your patients, that you are feeling burdened by their needs and that you will want to do something. So even though you will not be reimbursed for your time and your efforts, but just knowing that you're making a difference in your patients' lives and in the downward, like the trickle effect of their families and their neighborhoods and their lives, that will motivate you to take action.
Yeah, very good. Very good. Thank you. Okay, I'm going to put on the screen here our CE. So I'll stop the recording.